but these young children were tremoring in fear. And then I looked at the adolescent children, and they were starting to shake, but they were trying to control it. I'm seeing something organic in the children that we haven't learned yet. They haven't learned yet how to inhibit it. So when I got out and I asked the adults, do you shake like that? And they said, no, no, no. Because we don't want the children to think we're afraid. That when our stress levels go up, the body automatically says, oh, I need to reduce the stress. We're actually a self-regulating species, but we've taken away the very mechanism that helps us regulate. We should not be a species under stress.
Does that not also in some way release tension? What's the difference with this practice?
Yeah, running until you're exhausted actually does burn off all that high energy that you're trying to get out from stress or tension or anxiety. And so then I was working with a friend of mine who was a neurophysiologist, and we put those two together and realized that tremor mechanism is the response to release the fetal contraction that the body goes through. They're both organic. You don't think about body tremors and you don't think about the contraction. The body does it all by itself. And right there, it made me realize we've taken an organic mechanism, we've reinterpreted it as a sign of fear or weakness or vulnerability or shame. And so then we froze the mechanism in our bodies, much like we do with crying. And we can see that in the new fields that are coming up where we're using sound and vibration to actually break up cancer cells, as an example.
Hello everyone, salutare dragilor. Welcome to this Mind Architect episode about a topic that's near but not necessarily dear to us, which is stress, tension, maybe even trauma. Today we'll be talking in English because we will have with us the author and creator of a method that can help us deal with that tension, deal with that stress, better deal with perhaps the impact of traumas that we've been through. The method is called TRE, and it's something that can help us be better partners, be better parents, be better colleagues, simply through learning how to use our body's natural response to stress, which is shaking, trembling, tremors, in order to dissipate the tension that can accumulate inside of us. We will have with us today Dr. David Berceli, who's the creator of the method and who's the author of a book which is now thankfully also available in Romanian about the method that I just described, to walk us through how he created the method, how we can use it, what are some scenarios in which it might be helpful. David will walk us through the innate neurogenic tremor mechanisms that all mammals have, including us as humans, and how we can learn to trigger it, how we can learn to use it so that we are better balanced and we can release the tension that can gather up in our body, in our muscles, or in our facial tissue. We will also have with us Elvira Stanescu, who's an internationally certified TRE provider, compassionate inquiry informed, currently in training in somatic experience as well as psychodrama. Elvira is deeply passionate about how we function as human beings on an emotional level, on a neuropsychological level, and how we can use our autonomic nervous system to aid us in healing and in leading better lives. I'm also really happy to welcome them to our studio because I've personally practiced TRE and it's helped me better relieve my stress and especially release tension that was accumulating in my body. So, David, Elvira, welcome.
Thank you so much.
Thank you.
It's great to have you here. And to get started, I'm curious a bit with TRE. Can you walk us a bit through how it started?
Okay. I'm going to make a long story very short, but what happened was I was living in war for a number of years, and I began to see the human pattern in war when the person is in threat goes into a fetal response where they would contract the body downwards like that. And I saw that in everybody and in multiple countries. And I thought, we're not trained to do that. The body knows how to do that. So it has some organic mechanism in it to protect itself from the threats of life. But if you think of the evolution of any species, if it has a mechanism that's genetically encoded for protection, it must have a genetically encoded release mechanism as well, or else we wouldn't survive as a species. And so I began to observe the contraction, and I thought, how's the body releasing that? And then several years after that experience, I was in a bomb shelter, and I was sitting there, and it was very terrifying for all of us. But these young children were tremoring in fear. And then I looked at the adolescent children, and they were starting to shake, but they were trying to control it. And then none of the adults were shaking. And that fascinated me because I thought, I'm seeing something organic in the children that we haven't learned yet. They haven't learned yet how to inhibit it. So when I got out and I asked the adults, do you shake like that? And they said, no, because we don't want the children to think we're afraid. And right there, it made me realize we've taken an organic mechanism. We've reinterpreted it as a sign of fear or weakness or vulnerability or shame. And so then we froze the mechanism in our bodies, much like we do with crying. It's very hard for adults and certainly for adult men to cry anymore, but not because the organism doesn't want to cry. We just don't let it. And so then I was working with a friend of mine who was a neurophysiologist, and we put those two together and realized that tremor mechanism is the response to release the fetal contraction that the body goes through. They're both organic. You don't think about body tremors and you don't think about the contraction. The body does it all by itself. So that's how it started, just by me observing the human nature of a living organism, the human body.
And this also happens in other mammals, for example?
Oh, yeah, it happens in all mammals. That's been well researched, except for domesticated ones. Domesticated ones lose the freedom of being able to run away from the stress or the threat, whereas in the wild, animals will encounter even a life-threatening event, and it could be every day, but if they run away and escape and go to the watering hole, you'll watch them shake, much like we see a dog shaking in a thunderstorm as an example, okay? They shake automatically without inhibition. Unfortunately, we have an ego that can inhibit that shaking, and that's where we get stuck as humans.
And I guess that's why we don't see it more often. And in your example, you
We
saw it
should
in the
see
children.
Exactly. We should see completely natural, normal, every day, that when our stress levels go up, the body automatically says, oh, I need to reduce the stress. We're actually a self-regulating species, but we've taken away the very mechanism that helps us regulate. We should not be a species under stress.
And to a degree, we're also subjecting ourselves to a lot more stress in the modern world.
And so then we should have a lot more discharge to combat that increased stressor. And we could still live happy lives, even though we have more stressors in our society.
Mm-hmm. Got it. Thank you. That's an excellent point, especially since this seems to be like a hot topic, even in
very much so
from our audience and in our training courses. That gets asked a lot. I have a very high stress level. What could I do to decrease it,
right,
to manage it better?
And it's really sad because what we can do is simply give in to the body because it knows how to release it. And that's where we have our struggle, is letting go into the body's natural release process so that we wouldn't overstimulate ourselves.
Mm-hmm. What does happen in the body when we do allow ourselves to tremor, to shake, to vibrate? What changes at the biological level?
Well, when you think about it, the human organism is a neurobiological organism, meaning the brain and the body both work together. So when we activate the shaking mechanism, what happens is it begins to send signals up the spine, and it sends us signals into the primitive parts of the brain, the brainstem and limbic system, and then the brain responds back with calming down. So there's automatic communication between the nervous system and the fascial system, and they together, collectively, without the ego's interference, they know how to re-regulate the structure. And so the thing about what we call tension and trauma releasing exercises is it's not really a technique or a method. We're just activating the body's neurobiological system to actually do its own work of reducing the stress and integrating the mind and the body into a calm state.
I was trying to think in terms of like the branches of the autonomic nervous system.
Right. Well, yeah, you have the central nervous system and the peripheral nervous system. And that's it. We start activating the shaking from the peripheral nervous system through the exercise routine that we do, but that immediately starts to send the signals into the central nervous system up the spinal column. So the organism knows how to do this by itself. We just simply stimulate the shaking. The shaking knows how to communicate throughout the structure, and the brain knows how to respond to that.
Mm-hmm.
Your response was very ample. I would go forward with the practical part of TRE, and I would like to share a little bit of my experience with TRE. I am practicing for almost 5 years. I was in my mind very much, and I think our society is very much still focused on the mind and to be up here and to be intelligent, and we kind of forgot the body. So this is my story also, and in my journey, in my transformation and healing journey, I feel like, okay, but I have a body. I feel like there's more. So I started doing TRE, and ever since, I still remember my first group, my first session, and it was like you, Adi, said, that it was releasing. People were crying, and I was just like, oh my God, my body is so relaxing through that tremor. But I would like to ask you, from your experience, because you work with thousands of people, what is, in your experience with us, in the first time we are making, we are connecting to our tremor, the experience of people? Mm-hmm. There is openness? There are contractions? Is there fear from your experience when the first time people try to tremor?
Right. Actually, there's all of those, because we don't know where the person is coming from when they first tremor the first time. Are they able to let go? Maybe people have done body work already. They give into it more easily. Somebody like yourself just lays down and you're not caring about anything. You let the tremor take over and you say, oh my God, this is amazing. I'm just relaxing. I'm not doing anything. My body's doing it. Other people will come in, and when they tremor, they immediately have access to emotional state that's connected to the very pattern that's being released. And that's what I like about it. It doesn't release an emotion unless the tremor mechanism has already accessed the pattern in the body, and then that's the integration. If the body has an emotional discharge where it's tremoring, that means it's connected itself, and it's actually healing itself. Even though we might judge, oh, I don't like crying, or I shouldn't be doing this, or whatever, that's the ego just observing and then not permitting it to happen. But the organic pulsation of the body said, oh, here's the pattern that's tight. Here's the emotion that was associated with that when I had the tightness, when I created the tightness. And it's saying, oh, I can release the tightness. And then the emotion says, oh, I can let go now too. I don't need it. And so it organically sort of pulsates its way back into a healthy and calm state.
And I would like to add, as you said previously, that it's a connection between the brain and the body, and it's a dialogue.
Yeah, because this human organism doesn't know we've separated brain and body. It doesn't function that way at all. It functions as one whole unit no matter what we do. Neurology and physiology are always talking to each other. We might think we're just in our head or think we're just in our body, but that does not exist as a reality to the human organism.
Looking at the very name of it, the T can stand for both tension and trauma.
Right. That is something that we changed. It started out as trauma releasing exercises because I was living in war, and I wrote my first book for people who were living in difficult situations like that. But then as it progressed, we realized, wait, it can do everything like reduce mild tension in the body, to stress. It doesn't have to be trauma, because a lot of people don't identify or don't even want to identify with trauma, but everybody will identify with tension. And so you say, oh, well, this will just release tension. And for those who only want to go to that level, it works really well for them. Because some people say, well, yes, I have trauma, but I don't want to deal with it right now. And that's fine. I respect that. But there's no reason you can't reduce tension that you picked up just from the day. See, and so I like that. That's why we changed it to tension and trauma releasing exercises using the same acronym of TRE. But it is a great stress reducer.
Got it. I've felt that personally myself.
Mhm.
And the subjective experience was like it was this amazing sense of relief that the tension was just kind of exiting my body. But at the same time, I was noticing, because it was a group class, people around me who were sobbing or who were crying.
Mhm.
And I'm also curious if there's a kind of pattern that you've seen in terms of how people's bodies react versus what they've been through or what they are storing currently.
Yeah, it's a little bit complex because some people have been through very severe traumas. If you give them even the smallest release, their body will begin to open up because it's so grateful to be able to have the release. Other people who have been through severe trauma may have to do this 3, 4, or 5 times until they feel safe enough in their body to let into the release process. So that's where it becomes a little bit individualized, because I could put 30 people from 30 different countries in the same room. They'll all have different discharges according to where they're comfortable in terms of discharging, because it's really the body's starting to come back alive again. No matter what trauma it's been through, what stressors or tension it has, we live in an organism that pulsates constantly. I want to live. I want to live. I want to live. And the tremor mechanism in the human body assists that pulsation. But see, coming alive can be frightening for people, and some coming alive could be exciting for people. And it depends on where we're at. And sometimes it may vacillate back and forth. I'm willing to come alive to this degree, but I don't want to go into an old trauma of childhood. I don't want to come that alive yet. And so we have to allow for a pulsation, if you will, of restoring myself back to my fullest human potential.
I'm also curious if there's a risk of overdoing it or maybe being overwhelmed. For example, if I'm trying to practice on my own, can it bring up, I don't know, strong sense of shame that I've been storing and
Right.
avoiding?
Yeah, there's always a risk of overwhelm, but the only reason that is because we're not used to self-regulating. We're either used to being tightly controlled or completely relaxed. We don't know that there's this whole world in between the two, because we've never been trained that way and we don't live that way. We live in a very controlled culture. So the minute you get something that starts to release, if we don't understand how to regulate release and when is it release enough for me, then it can become an overwhelm, see? And so that's when we need clinical therapy or a close friend or a partner or spouse, somebody to help us regulate and maintain boundaries and to slowly let ourselves open up and release all the tensions that we have in our body. So again, it's got to be like a gradual process of pulsating back towards aliveness, not just a big explosion towards it, which is what a lot of, when I was in Thailand recently, a lot of younger people in the young generation are using some sort of substance because they're trying to do the same thing. They come there because they're tight, their culture's rigid, and they're frustrated in life. And so then they take some sort of substance because they're trying to just open up and feel alive again. That's their first step, but it's opening them too quickly, too much. And then all they do is close back up again afterwards. And so it's like, how do we get into our culture this concept of, no, let's just slowly take a while, take a month, a year, whatever, to slowly pulsate ourselves back into aliveness.
Mm-hmm. So to pace ourselves and not to do too much, to make
Exactly.
sure to take breaks, perhaps.
Oh, absolutely. Yeah. Yeah. And so that's what I tell everybody. Initially, you might need a therapist to guide you through the process, but ultimately their goal is to help you learn how to regulate, to do it at your own speed and in your own self, because TRE was initially designed when I was living in war. So there were no therapists there. And if there were, they couldn't deal with 1 million people who were traumatized. And so it had to be a self-help routine. See, and so that's how I designed it. Now, bringing it into the Western world or other cultures where we do have therapeutic guidance available and we have different body modalities and all that sort of thing, we can use them to help us learn how to do this regulation.
Got it. Thank you. When you say different body modalities, what are you referring to?
Well, like a massage, cranial sacral work, chiropractic work, anything that helps somebody get back into their body, even yoga. You don't have yoga in a lot of war zones, and people aren't going to do a 1-hour yoga session.
True, especially in that context. Got it. Any other do's and don'ts in terms of how to start doing TRE since we've started on this?
Yeah, I think the best one is do it with somebody who knows how to guide you through the process. So they educate you, they observe your body, and then they tell you, oh, you look like you're comfortable and safe with it. Go ahead and do it at home by yourself, and then come back next week or next month, and let's see how you did. Were you comfortable with it? And then we can help them regulate their speed of opening up. Because the TRE providers here in Romania who have been trained in this are very quick at seeing, oh yeah, this person's quite grounded, integrated. This is just stress they're releasing, different than somebody who comes in and they have to deal with a trauma of a divorce recently or something like that that's intensely emotional. Then we want to help regulate them through that a little bit slower.
Got it. In which case it would be even more important to pace them. And
exactly right. Yeah.
Go gradually.
Yeah.
Are there specific protocols depending on what I might be trying to deal with, for example?
Yeah. Now you're starting to get into a little bit more of a psychological perspective rather than the pure physiological exercise routine. So then you need to look at somebody who knows how to get you through that. As an example, you talk about a sports coach. They would do it very differently than a psychotherapist would do it because they understand that sports coach, they know what your body has been through, how to help you regulate release. And so we're looking at different professional backgrounds for different people.
I would like to ask specifically for the people that tried at home on their own. What would you advise them to be careful with?
The only thing they really need to be careful with is doing it too fast and too long. Because some people say, oh, this is wonderful. I'm going to do it for an hour every day. Well, right there is the ego again interfering with them feeling their body. The ego might say, I'm going to do it an hour every day for a month. But the body's not saying that. See, our difficulty is that we use the ego that's already injured from a trauma, and we use it to apply the recovery process. So if the trauma was severe, we'll often force ourselves through recovery process rather than gently go through it. And it's the same principle. And so it's always about do it slow. I always tell people, if you're doing it by yourself, no longer than 15 minutes, just so your body can experience it. And then don't do it again until like maybe 2 days later, because you want to see if maybe within 2 days something may have come up or surfaced that didn't come up immediately, and then they can figure out how to regulate it for themselves.
We're talking 15 minutes, just the trembling itself?
Just the trembling itself, yeah.
Got it. So not including the stretching beforehand?
No, just the trembling, yeah.
Okay. And people can find, for example, the stretches. I know you have them on the website.
Yeah, it's all on the website. YouTube, I have a lot of YouTube videos of how to do this and how to take care of yourself. But you've got treromania.org that has there's a great place to go for information about how to do this safely.
Super. Thank you for the resource. Now, looking at it from a more, I'll be the devil's advocate.
Yes.
How is this different from other ways of essentially exhausting myself physically? If I just go out and run until I feel like I just drop after.
Right.
Does that not also in some way release tension? What's the difference with this practice?
Yeah, running until you're exhausted actually does burn off all that high energy that you're trying to get out from stress or tension or anxiety. It burns it off, but it doesn't it only exhausted the body. It didn't do anything to create a change inside the structure itself, which is what the shaking mechanism does. So all those tight patterns could still be in there. You just exhausted them from being active. So you go into a parasympathetic response for a short while, but all the tight pattern is still there. And so you just come back right into the same pattern again. You didn't do anything to change the internal structure of the pattern that's generating the stress or the tension or the anxiety.
You're emptying the bucket, but you're not
exactly
closing off the faucet, so to speak.
Very good. That's a great analogy. I like that. Yes. And one more thing, though, with that, and this is what's different about the tremor mechanism in the human body. It is not ego-driven.
Mm-hmm.
Whereas when you do other modalities, it's your brain telling your body how to do something. In TRE, yes, we give you some exercises to do, but they're only for the purpose of activating the shaking mechanism.
Mm-hmm.
That mechanism then works out of our consciousness. We're observing it, saying, this is weird, this is odd, this is wild, what's going on? But that's perfect because it's showing you it's not ego-directed. It's the human organism actually restoring its own aliveness, circumventing the ego. That's very different.
I remember even when I was learning how to, for example, expand the shaking, because at first it was just my legs.
Right.
I was also used to doing that. Like after these really difficult training sessions back when I was an athlete, we would sometimes just shake naturally. So doing that in the first TRE session felt good. It felt like releasing tension. But then like I was also like peeking around and seeing other people were like shaking with their whole bodies. And I remember when I first started like shaking with other parts of the body, it also felt a little bit exposed at one point.
Yeah.
And there was this sense of, is this normal? Is this okay? What's happening?
That is so funny to me. Everybody wants to, is this normal? I get that so often. And I say, if your body's doing it, it's perfectly normal because your body knows what's the next pattern that it can release. And so it goes to that pattern, whether you consciously understand it or not. It's like it couldn't go there unless it was capable of going there and releasing it. See? And so that's what's cool about it, is that the body is doing its own self-restoration. We become more the observer of it, and it's showing it. I can do your left shoulder, I can do your right arm, but I can't do the left leg. See? And then that becomes the practice, the technique of the practitioner to figure out how to get that shaking mechanism to move through the whole structure in sort of a more harmonious way.
Yeah, I remember some really nice tips and tricks in terms of how to expand it further.
Yeah.
Got it. You talked a lot about how it changes patterns. So can we consider it even a way of triggering neuroplasticity, for example?
Oh,
Is
absolutely.
That what's happening?
Yeah. When you think of, again, all of the components in the human body, when you think of muscle and tissue, fascia, nervous system, they're all interacting, central spinal generators along the spine. Everything is interacting with each other. The tremor mechanism, it would be an impossibility that it is not interacting with everything. They all sort of stimulate one another. The tremor mechanism, if you could think of it, is activating the electrical current in the body. And then the electric current goes through every part of the body as a communication system. And so that's all we're doing, is stimulating its own communication system. But at a higher level than what we normally do, we contain that communication system through containing the tremoring. And so we actually dull or deaden a little bit the body's ability to communicate because it needs this shaking mechanism. It's part of its communication. And so once we stimulate, it says, oh, thank God you activate. It's like turning it on. Oh, I know what to do with it now. And then that's what we observe, is what does it do in an athlete, or what does it do in a woman who just gave birth 2 months ago? Completely different patterns would surface, but both would be 100% correct.
Because it would be what the body needs
exactly
in that situation.
Right. Yeah.
Which I guess leads us also to the difficulty of leaning into it, because for a lot of people, the body is something to be either ignored or, in my case, ordered around.
Right. Yeah. So that's what athletes do. When I work with them, even military a lot, I work with them, is that they train one pattern in their body to be repeated over and over. Now that's healthy because it helps you perform
That
that
movement,
sports
Mhm.
better that you're involved in, but it's a completely disorientation to the body. If I use my right arm to throw over and over and over and never my left arm, I'm going to create a pattern that's inconsistent between left and right side. That's why many pro athletes retire at a very early age. Their bodies are damaged. See, and so they start getting lower back pain, shoulder pains, neck pains, all these types of pains that are from the imbalance of being trained professionally. And so the tremor mechanism, when I work with athletes or military, as an example, it starts to restore the balance back. It reduces lower back pain and increases their performance ability because now the body's back in sync with one another, both left and right sides or the top and bottom sides. And so now they're rebalancing again.
Or you've released the tension that can sometimes get in the way of just doing things intuitively,
Exactly.
especially since you've done them like 10,000 times. So
Exactly
you
right.
don't need to think about it.
Right, precisely.
Okay, fair enough.
And I would like to add from my personal perspective that the tremor mechanism opened for me a consciousness of my body and where it's tight. And when I have the same pattern, I noticed it better since I am tremoring, because it's bringing me and making me more aware of what is happening inside. Mm-hmm. It is not on automatic pilot anymore. So if I have a contraction here, I may address it better. I may even do a TRE and move it here through interventions. But it's not automatic, as I said before. It's more aware.
So it's something you can even direct. Like if you feel like there's a lot of upper body tension, you can direct your response to that area somehow.
You said it yourself that your feet trembled first and afterwards it went. Mm-hmm. Yes, through intervention, through touch, we may able to do it, but in a respectful way to the body, not to force it, but to guide it.
To guide it, to invite it.
To invite it, yes.
I like what you said. That's a very good point. When we stimulate the shaking in the body, it's the sensory receptors in the body are sending signals to the brain. And that's where it creates your awareness of, I never knew my shoulder was tight. Well, that's because now there are sensory receptors stimulating it, saying, I'm tight. And that's one of the things that the shaking does. And then it helps you pull your own body and brain back together and say, well, that's tight. How do I help that release? And now you're sort of increasing your awareness, as you said, and your consciousness. I'm living in an alive organism, and some places in it are tighter than they should be. But it was the sensory receptors from the tremor mechanism that created that conscious awareness. Very good point.
So in a way, it also helps us recognize how our body is feeling and how feeling, for example, safe might feel in the body.
Exactly right, because we don't know safety very well because our societies and our cultures, the way they're designed, we actually constantly pull up because something isn't safe externally. And we do that so regularly, so often, and so intensely sometimes that we're completely deadened or numbed, and the sensory receptors aren't sending enough stimulation to say, you're feeling unsafe. We're living in a state of unsafety. Even though you're sitting in your living room, relaxing for the evening, your body is still in a state of protection.
Perhaps also because of the accumulation of stress and tension inside the body.
Yeah.
Because unfortunately, we live in a context, or fortunately, depends how we look at it, we can no longer run away from the tigers because it's no longer a tiger. It can be the boss.
Exactly right. Exactly right. Or just driving home in traffic that, it's tight and tense. So we actually have produced a society of extreme tension. And so we need something to balance that out so that we can downregulate at the end of every day.
So would you recommend doing this in the evening, for
example? I do it every evening, actually. And I can tell that sometimes I need like 5 minutes and that's enough. I can feel my body say, okay, we let it go. Sometimes it may take 15 minutes and then the body says, okay, we let it go. And then I can just fall asleep much easier.
How do you recognize when it's been long enough? What changes?
Well, that's a little bit complicated because that's sensory reception in the body. I can just feel like in my body that whatever it was tight. And sometimes I don't know exactly. It could be a fascia pattern that's tight. I don't feel it specifically, but I feel that something's not moving easily. And then all of a sudden it starts to pulsate and move easier. And I think it's when it pulsates in my diaphragm will go, ah. And then that's like, oh, okay, my body got it. It found the release and we're done.
Mm-hmm. I'm asking because for me personally, this has sometimes been a challenge. Like at first it feels super releasing and relaxing. And then there comes a certain point where I feel a need to kind of, I don't know, shift the position. I feel like maybe some discomfort, and I don't know whether I'm avoiding discomfort or I'm listening to my own body, because I'm so used to either avoiding the discomfort completely or pushing through it regardless. It's hard to find this kind of middle path.
Yeah, that's wonderful. You just talked about two different extremes. I'll avoid it, or I let go into it too much or something. And the whole point is that as we continue to do body awareness types of modalities like TRE, we become more sensitive. So I tell people, it won't matter if you avoid it, and it won't matter if you let go too much into it. Just keep doing it, and eventually the body will be able to pulsate between those two. So you kind of grow into your sensitivity instead of judging it. Oh, am I avoiding it? Am I pushing myself through it? Doesn't matter. Just follow what it feels like at that moment, because one day you might feel like avoiding it, and I said, go ahead and avoid it. One day you might say, I want to push through it, and I'll say, go ahead, push through it. Let's see what happens. So you take the judgment out of it.
That's hard.
That's a tough one for all of us, yeah.
Taking the judgment, taking the thinking out of it, or the overthinking out of it.
It's precisely, because we're trained every day of our life to be overthinkers.
I'm curious, in the process of introducing this in various cultures and various places, what differences you've noticed, and maybe even how you've had to adapt it in a different way based on the group of people you were teaching it to.
Very adaptable all over the world. The first time, I'll give you a couple of small examples. The first time I went to China and I was teaching this, and I went to the National Institute for Chinese Medicine. So I'm teaching all these trained doctors in Chinese medicine. They laid down on the floor. They finally started to tremor. I let them tremor for about 20 minutes, and they sat up, and this one doctor looked at me, and he said, how interesting. He said, you found a Western way to move qi. And that's exactly how it fit in their concept. I was just moving qi. They understood qi energy. They did it with acupuncture and other Chinese modalities. They said, we're going to take your Western style, and we're going to use that here. But they didn't call it TRE or anything, which was fine with me. It was just another way to move qi to them. So it was really kind of interesting. And then with a number of Latin American and African cultures that aren't so controlled by our Western sort of mind, they were more relaxed and more free in their bodies. And so they didn't even sometimes need exercises. They were already so flowing and moving and free in their bodies, and they would start to tremor. But what was very interesting is now it became relational. So they would hold somebody's hand, or they would look at each other in the eyes, because relationship was very important to them. So as they're coming alive, it was organic and natural for them to have relationship with the person next, and they're having aliveness. So when we would do large groups in South America, I said, all right, if somebody next to you starts to cry, just hold their hand, and then we'll create the relationship. And they did an amazing job because it was so natural and easy. Whereas in Western cultures, Western European or American cultures, if you told somebody to hold somebody's hand while they're crying, you would think that was inappropriate, as an example.
Or maybe even it would make them stop crying.
Exactly
like,
right.
You're right. Sorry.
Exactly right. So I did adjust it to the cultural context, and it's very, very different all over the world. It's the same tremor mechanism, but it's taken up in a cultural way differently.
It's filtered through our beliefs, our convictions,
Exactly
our way
right.
of being.
Yeah.
How has that worked in Romania? What did you have to adapt to bring TRE here?
Why
I
don't you
wanted to
speak
ask
to
that.
that? You speak to that
You
first.
can
Then
answer
I'll
it.
Yeah, exactly. You answer it, then I'll tell you what I think.
It's well adapted here also because we are having so much collective trauma, and we will talk about this. And we need to be safe in groups. We need to be safe in relationship with our facilitator, our boss, our therapists, and we did this in a weekend. Over the weekend, we had a gathering with many TRE providers, and he adapted to us and to the energy there. But I feel that TRE in Romania, it preaches to us to be more open, to fear less, to listen to ourselves, bring us here into our intuitive feeling. The technique itself, it's adapted. I don't know how much. I don't think that it's as in China that you took the TRE. We adjusted to the TRE process as it is, but the way we are learning it, it's through. It teaches us connection because we lack that from communism.
Connection between each other
Connection-
or connection with the body?
Both. But we need connection with each other so we can feel a lot safer, because you mentioned safety, in order to not feel alone. And I think that David did this in our community in this weekend, but in the way that TRE was built. So through TRE, we can relearn to be together, because we need that. So I think that this is the adjustment here, and what we are learning from you directly, to be more in connection with each other. The stretch itself, they are a little bit adjusted, but basically they are the same. The method, the technical method, but going deeper, it's about connection and feeling safe among other people like us. So it's with our body, but it's also with the community, with other people. We all have tremor mechanism. Not only me, not only you, not only David. So we can do this together.
Yeah.
It's nothing wrong with it.
Yeah. What I found, this is fun for me, this culture, the Romanian culture, you're very high energy. You're charged culture. And so it's like, okay, well, we have to first use the tremor mechanism to reduce a little bit of that charge so that people just kind of relax a little bit more into themselves. When we relax more into ourselves, we actually organically are a little bit less defensive. And when that happens, we're a little bit more trusting. And if you can regulate that speed going down little by little by little, you can go to great depths. So my whole thing over the weekend was, all right, let's reduce a little bit, and then I'll talk about what I see, but I'm talking just about what I see in the human organism. So I'm not addressing the society, the culture in a sense, or anything ego or threatening. I'm just saying, oh, that was interesting. Watch this body. Let's see what it's trying to do. My whole thing is, let's see how it's trying to come alive, because all of us are living in one. So when everybody was watching me as I was working on individuals, their bodies were relating to that body. See, so it had nothing to do with
empathy, not cognitive, but emotional.
Yeah, so it was more sensory communication from body to body, and then people could see. And it often happens if her diaphragm releases and mine needs to release, I'll begin to feel that somatically in my own body. And so we're using the body's ability to communicate. Remember, we're pulsating organisms. We're kind of like a big amoeba, that's all. But all of these big amoebas communicate to one another sensorily and not necessarily cognitively. And so I sort of capitalized on that. I know that you've got communist rule, and I know that means lack of trust, lack of transparency, danger. But I know the human body speaks about safety and relationship. That's what it needs. So I just addressed at that level what was going on. And then all the bodies in the room started to co-regulate together. That's how I dealt with it here.
I'm also curious, building on this, if you've noticed people who are in helping professions, because we have a lot of those in our audience, coaches, psychotherapists, trainers, teachers, people who spend a lot of time kind of holding space for others in various ways.
Right.
If they seem to have, I don't know, to need something different from TRE or to get something different out of it, that might be perhaps worth mentioning.
Well, I think the thing for all of us who are coaches and therapists and helping other people, even yoga instructors or sports coaches, I mean,
all personal
of us,
trainers.
Exactly, personal trainers. If we're holding space for somebody else, that means a lot of my energy is going sort of external. And I think we need to look for how tired we are, how much did I have to deaden myself in one sense to keep space for you to be alive. And so it's about going in and out of ourselves. So after a workshop that I give all the time, I spend a lot of time by myself, just feeling my body, letting it breathe again. And now I'm putting my energy back into me and not using it as a container for other people. And so that's what I think is most valuable. And many of them do it through their own ways. Maybe they go for massage at nighttime, or they go into a thermal spa or something like that. But we're all still instinctually, the body's saying, take care of me. Take care of me. Go take care of me. We have many ways that we do that, see. And TRE is one of those, as much as yoga or anything else would be.
Mm-hmm. In which case it might even feel like, for example, if I've been pushing myself to help others while I'm running on empty, at first it might feel like I'm reconnecting with that sense of exhaustion, and I feel more like stopping and like my energy is decreasing.
Right, exactly, yeah. And we have to pay attention to that. I feel more like stopping. Okay, if that's coming from your organism, then that's the right place to follow, because it's informing you. Because to be a coach or to be a clinical therapist or whatever, we often have to put a little bit more energy in our heads than in our bodies. Now, we'd like to be balanced, but that doesn't always work that way. And so when we come back and we can go back into being balanced, then our body is sending signals saying, that was exhausting for me. You got to give me some time or some space to recoup inside myself. And that's what we have to respect.
Or maybe take into account, and if, for example, I still need to push through 2 more days, maybe in that case, would it be better not to practice, or would the practice guide me if I listen to my body?
No, I use it even when I know I'm really tired, but I use it as a way of like just reinforcing, okay, feel tiredness. So when you're giving your next lecture, go ahead and let yourself be a little bit tired when you give the lecture. Don't pull up. You don't need to. You can give a good lecture with a lower energy field. And so I use it to try to keep me regulated, but still be able to hold a container for group of people.
And I would like to say, from my perspective of TRE provider, when I am doing my own TRE, I feel more grounded. I can hold up space more safely. I'm not triggered. It's easier for me to hold space for others.
And in a way, if I were to describe it in a very rational, clinical way, it enables you to use your abilities to the best of them.
Yes.
Like whatever level they are at, it enables you to access that level of containment, of understanding, of teaching, of energizing, of whatever it may be.
And also what you said, that maybe we will enter with a low energy, but I'm aware of it.
Mm-hmm.
And I know that I need to rest after this, but I use it as a resource. And it helps me get more regulated, not being on maybe a fight, flight, freeze response, and be more aware.
And be able to accept that this is my current energy
Yes.
level.
Yes,
Right.
yes,
It
Yes.
will be I will be a tired trainer today.
Right,
Yes,
exactly
But
right.
I can still be a good trainer.
Exactly
Yes.
right. That's absolutely true. That's what I found in my life too. It's like I can be tired, but I could still be spot on. I could be really sharp. Even some ways my energy is less going out there and it's more reflective and sometimes even more impactful and powerful than if I go into my head too much and sort of teach.
Especially if that's something that people are also feeling like they need to do what they do
Right.
while also being tired, overwhelmed,
Exactly
or
right.
exhausted.
Yeah.
Mhm. In which case it also serves as a liberating example, perhaps.
Yeah, very true. Yeah. If we can do that ourselves and people see the quality still of our professional behavior, they're saying, wow, that's interesting. They could be tired but still be profoundly impactful in what they're doing.
How can we try to bring together mental control and bodily regulation?
It's kind of interesting when people say, how do we bring it together? It's by not trying to bring it together because we're genetically designed that way already. So trying to bring it together is already the ego going to try to control something to happen, see? But that's the very thing that's preventing that from happening. That's one of the things I think is great about the tremor mechanism in the human body. You don't really try it. You just activate it and then just lay there and let it bring together the mind and the body because it's inherently integrated already. We have to take away the things that are just preventing us from feeling the integration, but it's not that no one is integrated. They just can't feel or connect to their integration, and that's very different than how do I integrate myself.
So it's basically let go.
Exactly
of
right.
the attempt to
And
do it consciously.
Terribly sad. Let go is a simple statement, but it's exactly right. Learn to let go. But that's precisely what our culture teaches us not to do. See, so we're actually going against the culture when we say, I got to let go and just allow my organism to go back to its natural state, which is its healthiest state possible.
Which leads us back to how you saw the children doing the trembling,
Exactly
the
right.
teenagers stopping themselves, and the adults stopping themselves.
That was so
completely from it.
insightful. I looked at those little kids and I thought, they're not controlling everything. They're just being alive. Actually, they were more alive than we were, pulsating and vibrating. Now, yes, they were scared, but if somebody had retranslated that to them and said, oh, that's not from fear, that's because your body's staying alive. What if we reframed what body tremors were? You know, it's aliveness, it's pulsation. It means you're integrated, that you're doing this. Different than you're out of control, you're frightened, you're vulnerable, you're weak. That's the translation we have right now. That's the narrative for body shaking. Different than, oh, this is wonderful. Your body's alive. It's pulsating because you just had a stressor and it's going to calm you down. So it means you're actually healthy.
What about people who are disconnected from this sense of vitality? For example, people who are depressed.
Mhm.
Would it still work? Would it still help?
We're
in that
doing
context?
research right now in China, actually, with depressed teenagers.
Okay.
And we're using brain scans, and we discovered that they're actually increasing their brain activity when they do TRE, whereas their parents, who we're working with as well, have high brain activity. Theirs is decreasing because they're trying to control the child who has depression. So they're overthinking, whereas the child is underthinking. And we're watching it balance itself. That's what the tremor mechanism is doing. It's balancing brain activity. Because it doesn't matter whether the imbalance is high or low, it's bringing it back to balance. So it's fascinating. We're just getting the research, getting the data back from the research.
That really does sound fascinating.
Yeah.
Any other research on TRE that you want to share? Since we're on
no,
this?
right now there's 5 research projects going on in China. I was just there for 3 months, and we're working all those. If you go to my YouTube channel, I have all the preliminary results of the research on YouTube. I did, I think, 4 videos of it. But basically what it's doing in every research project is it's rebalancing the nervous system, and then if it needs to change cognition or sensory receptors, it's doing it naturally. No matter what person or what illness or injury they have, it seems to be moving towards balance. So, and I think that's what it's designed to do.
So either decreasing the level of activation or increasing the level of activation depending on what's needed.
Exactly right. Which one is imbalanced, and then it's restoring the balance of it.
So I guess in this way it can also help if we're parents, for example.
Oh, very much so. We use it a lot with parents in China, actually, because if they have a child who's experiencing depression or ADHD or something, the parent is under tremendous stressor. And so if you can reduce the stressor, and there's some research coming out about this, if you reduce the stressor of the parent, you'll reduce the hyperactivity of ADHD. Because they're feeding off the parent's anxiety. So it becomes this cycle.
Oh, it's a vicious cycle.
Exactly right. And so if we calm down the parent, the child actually calms down. It's very interesting.
So you can use it as a parent to help your child, but primarily through helping yourself, from what
exactly
I gather.
right. Because parents need it desperately if they have children who have got some sort of dysfunction going on. The parents need it because they're still the container in many ways for the child. And so then they need to look at themselves and keep themselves healthy. And that's a little bit hard in our society as well.
Yeah, especially if we're oftentimes we're also a bit socially isolated.
Exactly
we're
right.
no longer part of community.
Yeah, socially isolated, overworking, tired from taking care of a child who might be having difficulty, never having a moment to yourself. The tremor mechanism helps them let go into themselves so that they could feel that this is what's going on in them, so that the parent themselves don't get overstressed and have their own more serious dysfunctional patterns start to surface.
I also felt like it helped in my relationship.
Because, tell us how.
Basically through releasing tension in a healthier way. Which would then enable me to be more of what was needed, I would say.
Yeah.
Depending on the context. Sometimes it was just enabling me to talk about what I was feeling as opposed to try to knuckle down and power through it. And I'm not going to think about it because if I think about it, I will be more overwhelmed than I already am. And then that would also lead to disconnect. And this is one of the things I felt like it helped with a little bit, like this awareness that you were describing. Like what's happening in the body, what's happening inside me emotionally. And then it would make it possible to also talk about it, which as a, I don't know how to say it, emotionally half-literate person.
Right.
I've grown from being emotionally illiterate. I feel like I'm half-literate.
Most men have, so that's one thing. But what I love about what you said, and we've done this a lot around the world, is that when you reduce that stress, talking about the emotion almost becomes kind of natural or organic. It's not like I have to try or I'm afraid to talk about it. It's like it becomes just a natural impulse to say, wow, I never realized how hurt I was or how afraid I was or whatever. But it's not like you have to pull it out of the person or they have to push it out. Somehow when the body lets go of the tension pattern that's around that emotion, all of a sudden the emotion can come right out. And I learned this when I was working with a lot of military. They always said to me, I'm not going to tell you what I went through. Mm-hmm. They hated doing that because it would just relive the experience. I said, okay, we're not going to talk. But then they would tremor, and all I would do is watch their body and say, oh, that's interesting. Your left hip is moving differently than your right hip. I don't know why, but just notice that in yourself. I said, and just notice if you know why that would be, and I don't know why it is. And they would just lay there, and then about 5 minutes later, they'll say, oh, I know what happened. And then they would tell me the story of something from the past, but they were telling it from the present moment. So they weren't reliving that emotional state. They were reliving, my body's letting go of this. Oh, this is so cool. My body's healing what it went through, and they didn't have to tell the story. So I took that. And what we did when we worked with military is we would work with all the soldiers for one day first, the ones who returned back from overseas. We'd work with all the soldiers, and then the next day we'd bring in their spouses. And so we had the spouse watch their soldier tremor, and I would point out things that were going on, and then we would have the spouse would tremor, the wife would tremor, and the soldier would watch her, and it changed their relationship because now they felt they're healing together what he went through and what she had to go through with him gone. They're both stressors, but they had a whole different language and a different way of building relationship rather than sitting down and talking and all that stuff. They watched each other's bodies, and out of that came the talk.
Yeah, especially since, again, talking about it can feel like difficult, can feel like something they don't want to do.
Exactly right.
Because it would be harrowing to relive what they went through.
Exactly right. And when the body was prepared and it was releasing it, it just became more simple and easy to talk about.
David, you posted on your YouTube and Instagram channel a video several months ago about our own ability to heal ourselves. And it was a video about specific parts trembling.
Mm-hmm.
Would you develop on that, what you discovered on all your experience?
Well, what I saw when the human body tremors, it should be tremoring sort of the same way between left and right side, tops and bottoms, etc. But then all of a sudden, something would show up where maybe only the left shoulder would move and the right one wouldn't move. And I thought, well, that's odd. It should move back and forth between left and right side. So then I started asking people, did you injure your shoulder or something like that? And inevitably, there was some injury, either falling off a ladder or something simple like that, or, they broke their shoulder, or certainly a lot of athletes, they pulled their tendon and all that stuff. But I watched that the tremor mechanism goes right to the place of injury, and it actually moves the structure differently. And I have several videos on my YouTube channel about there. We can watch one person's left knee shaking really, really strongly. They broke it, and the right knee's not doing anything. It's just laying there quietly and calmly. And then it'll move up to the left shoulder or the left wrist, because once you injure one joint in the body, the entire side of the body, you overcompensate. But the tremor mechanism finds the overcompensation and releases it, and then restores the balance back again. So yes, it is designed to find specific injury and to resolve it as much as it can for the purpose, again, of reintegrating that part of the body that got separated from the injury, reintegrated back into the whole.
I'd like to shift the conversation more towards something that you mentioned earlier, this experience of collective trauma, particularly during conflicts, but not only. And I'm curious, for example, how is it different for people going through collective trauma than it is for people going through individual trauma?
Mm-hmm.
And how does that then relate to trembling, shaking, TRE?
Right. Well, there's a number of different ways of collective trauma. So you have one thing here in your culture, Romania, where you're under a very repressive communist control for many years. Only 30 years have passed since you've been out of it. So that's a collective trauma there. That would be different than, let's say, all of us are in a bus and we're in an accident and several people are killed or whatever, and it was very traumatizing for all of us. What will happen generally from that is those people will develop a stronger relationship than sometimes they even have with family members because they've been in a life or death threat together.
Mm-hmm.
And so they know, I can talk to you about this. But if I tried to tell my spouse about what that felt like, she would never understand me, as an example. So there is actually a collective human connection when you face life or death threat together. It's far tighter than many family connections are. So that's one smaller group. Now, in the larger group, like the whole country, as an example, we'd still have to break it down into maybe family units. How did communism affect your family from your grandparents or whatever? How much is it still active in you? And get 3 family units to work together. So they work individually and then they come together. And then we build from that, or get an organization, or like your staff here. How much of your relationship is still influenced by communism, or how much have you been able to get through? So we have to break it down into smaller units to be able to get the cohesiveness to be restored in the relationship again. But the body will do it. That doesn't have the problem with it. It's just that do we have the safety to allow that trauma to let it go so that we can restore the relationship again?
In which case it could, so in practical terms, it could help, for example, to bring people together who might have had similar experiences. For example,
Absolutely.
I'm thinking like people from, I actually got a very good reference to TRE from my mother-in-law.
Oh, really?
She tried it, yeah, and she said she'd never been so relaxed in her life. And I was
Wow.
thinking, for that generation of people who grew up under so
Yeah.
much stress, for example, and some of the stressors were common, like the fear of becoming pregnant in a system where you couldn't have an abortion or use any contraception.
Mm.
So I guess there could be a sense of shared power and community and healing together if you were to gather people who have been through similar experiences together.
Yeah, that's very true. One of the ways I'm doing it in a number of other countries is working with firefighters as an example. They go through stressors that none of us go through. And it's interesting. Firefighters, like police officers and military, if you don't belong to that club, they don't want to talk to you because you're not going to understand what I went through. You know, that building collapsed. I watched a baby being burned alive. I wasn't able to help it. They feel guilt and shame. So what I do is I establish a training program where firefighters teach TRE to firefighters and the police officers and the military, because they'll all say to you, you don't understand what I've been through. And that's part of the safety, the trust, and the transparency. They don't want to go to a therapist. Almost none of them do. They don't want to go to a therapist. They want to go to somebody who will get it, who will understand them from inside. I know what that feels like, and I feel sorry for you that you had to go through it. But if they go to somebody who doesn't know that, they feel like they've just exposed themselves. They were raw and vulnerable, but it wasn't able to be received. See, so I'm all about, let's find the groups that we can put TRE into where the social structure is so cohesive already that they'll be able to help one another, so that we don't need just clinical therapists, if you will, helping all these different people, because we don't have enough clinical therapists on the planet to help everybody traumatized.
And they would have the extra barrier of not being from the field, not understanding
Exactly right.
it. I guess this is a general advantage of all the somatic approaches.
Definitely. That's why I try to train people within their own context to say, I'm going to teach you how to bring it to the other firefighters or police officers. You do that. I'll support you.
And I get this sense also that TRE can be easily integrated with other somatic approaches.
It can be integrated with every somatic approach, because TRE, in some sense, is not a somatic approach. It's really hard for us to understand, but it's nothing but the nature of the human organism to vibrate itself. So it's not like I have to do something to it as much as simply stimulate it, and then it does it. So once it's stimulated, it's part of the organic process of the human body. You can use any modality, massage, chiropractic, craniosacral, and the tremor mechanism will assist that intervention.
Makes sense. So then it's essentially an amplifier.
Very good. I like that word.
Doing.
Yeah.
Mm-hmm.
I would like to add here, because I have also other, I'm in training in other somatic approaches, and I combine them. And when I bring up the tension, maybe some traumatic imprints in the body, and mix it with TRE, the effect is maximized, because we are bringing more aware, we are touching the imprint, and we are letting go, because we said let go. We are letting go through tremoring, maybe the fear, maybe the contraction, and it works wonderful. We bring it up here, and we distress it through tremoring. I am doing this as a somatic therapist now, but this is the way I have worked ever since I work with my body. And I felt more rapid outcomes when TRE was brought in the session. It made me process and metabolize more quickly. And it's not about quick here, but I felt more efficient bringing two and two together for me and for my clients.
Yeah, it makes sense.
Yeah, we have a lot of people who are trained in many modalities, and I was recently in Norway, and so I had a chiropractor who's trained in TRE, and we watched a person tremoring on the floor, and so I told her what intervention I would make from my background, just in terms of TRE, and asked her what her intervention would be as a chiropractor. So, and we both agreed what vertebrae was stuck. We could see it. So I said, well, you make the intervention as a chiropractor. And she did. And the very same thing happened that would have happened if I had made the intervention, but I'm not a chiropractor. And it was wonderful to see those modalities, in a sense, like you said, it simply amplifies the ability to produce the release that many people in different modalities can see, like even fascia release experts can see, all right, we'll release it this far, but then the tremor mechanism will just take it a little bit further, see, and with almost no effort.
It makes a lot of sense
Yeah.
how they can amplify each other, the methods.
Yeah.
Mm-hmm.
I would like to ask you about that we have talked about integrating TRE with other modalities. I would like to ask you about neurogenic integration. What could you tell us about it? What's your vision on it?
Mm-hmm.
How it developed?
Right. Okay, so neurogenic integration developed because the shaking mechanism in the medical term is neurogenic tremors. Okay, so it was like neurogenic integration. It's the very thing we just talked about. How can we introduce TRE in a way to other body-based modalities and say, you just integrate this neurogenic tremor into your modality. So it's about basically just isolating the tremor mechanism and teaching body therapists how to use that. Because if you talk to any of them, fascia release expert, chiropractors, craniosacral, they'll all say that my client shakes when a certain release happens. But no one's ever looked at the shake and how do we actually use it to our advantage, manipulate it in a sense into the session. And so this is about educating. Yes, you've seen this a million times in your practice. Here's how we articulate it and how you can now use it to your advantage in the practice. So neurogenic integration is about integrating neurogenic tremor into other modalities.
To produce that kind of amplifying effect that we
Precisely.
just discussed.
Yeah.
Mm-hmm. Where do you see TRE going from here? What's next?
Well, I think it's what you said, and I think the field of medicine is going someplace brand new, and that's going towards vibration, sound, light, not medicine. And we can see that in the new fields that are coming up where we're using sound and vibration to actually break up cancer cells, as an example. And so the tremor mechanism in the human body fits precisely in the future of the health services because it is vibration. And so how can we use the stimulation and the vibration of the human organism and take it out of, if you will, psychotherapy, meaning it's limiting that, to say if we could restore the shaking mechanism in every human body, re-articulate it in a way that people find it natural and normal, I believe we could actually reduce the stressor of the human species, of all of us, see, because we're vibrating organisms and we're resonating towards one another in terms of vibration. That's why you could go into a room when everybody's tense and you'll feel it, see?
Mm-hmm.
Well, that tells us there's a lot more going on in the human species and its way of relationship with each other than what we have cognitively or psychologically really recognized. But I believe that medical science is advancing in its technology and its understanding. Like fascia, we never even knew what that was 30 years ago and what value it had for us. Now we're realizing it's one of the major communicating mechanisms in the human body. Well, now we get a chance to learn how to use it. We're going to discover the same thing with the shaking mechanism. It's one of the major communicating mechanisms in the human body, and the body needs us to stimulate it, and it knows what to do with it.
That having been said, if you want to add something else.
Just thank you for being here and sharing your wisdom with us in person.
Thank you.
And for studying it and bringing it to the world.
Yeah. Well, I'm excited by it because I see that very gently and slowly, everyone's kind of agreeing to it. They're kind of nodding their head saying, yeah, that makes sense. Let me give it a try. So we're introducing something completely new outside of people's consciousness, but there's some intuitive sense in them that's saying, I think I might want to try it.
Yeah,
and to me, that's
I've experienced bits and bobs of it, so maybe there could be more to this.
Exactly right, yeah.
Okay.
Good.
Thank you very much, David. Thank you very much, Elvira. So, guys, if you want to find out more about David, you can find him at his website, David Berceli.
David Berceli, website, YouTube, and Instagram. All of this under my name.
You can also find more information about TRE Global as a movement. You can find information specifically about TRE in Romania. So there's also the website for that. And happily, there is also now a book by David, which is in Romanian, about the method, about how to practice it, a little bit of kind of a way to kickstart things, and also a way of understanding more about why it works, how it works.
Yeah, sort of simple explanation that's accessible for a common group of people. I wrote it deliberately not for people who are in the therapeutic field. I wrote it for the common person to say, here, you have access to this. This is part of you. See if you can find this helpful.
So whether it be for yourselves, maybe for someone dear and close to you who you think might benefit from this, it's something that I can personally say it works really well when I remember to do it, when I'm not too stressed to remember to do it. And then I remember, and then I find myself trembling, and then I find myself relaxing as a result of that. So, and it's something often enough in the business world we can freely do under the table during calls without anybody being any wiser.
Very good.
Thank you very much.
Thank you so much for the invitation. That was delightful.
It was.
And thank you for your input. I appreciate it.
Thank you, David.
Acesta este un material gratuit prin care echipa Mind Architect contribuie la dezvoltarea personală și la cunoașterea de sine fundamentate în știință. Dacă vrei să aprofundezi subiectul pe care tocmai l-ai ascultat, devino și tu membru Mind Architect Premium, unde ai acces la peste 130 de materiale audio-video, rezumate infografice și recomandări de resurse. În plus, și poate cel mai important, întâlnirile MA Live, unde poți intra în direct cu echipa noastră pe teme care te interesează. Și acces la grupul de Facebook privat, unde ținem aproape de comunitatea abonaților. Iar dacă vrei să înveți în ritmul tău, te așteptăm pe mindarchitect.ro în secțiunea Online Academy, unde te așteaptă cursuri certificate, cu informație clar organizată, cu suport vizual excelent, teste și studii de caz. Poți asculta în continuare gratuit episoadele de podcast Mind Architect pe rețelele de podcasting precum Spotify, Apple Podcasts, YouTube și pe mindarchitect.ro. Iar dacă ți-a plăcut acest episod și crezi că i-ar face viața mai bună cuiva cunoscut, ne-am bucurat tare să ne ajuți cu un share. Conținutul Mind Architect nu este destinat și nici nu trebuie interpretat ca fiind utilizabil pentru a diagnostica, trata, atenua, vindeca, preveni sau un alt mod a fi utilizat pentru orice boală sau condiție medicală. Nu reprezintă substitut pentru consultație psihologică sau pentru muncă terapeutică.